He recognized, even in his last days, that it was a work that was still incomplete, and it's up to us to complete that work for the good of the American people.
The passing of Edward M. Kennedy has already become a factor in the healthcare debate.
Many are asking now, how will this shape the healthcare debate going forward?
The impact of the Kennedy legend has the potential to be immense, something his close colleague Chris Dodd recognized in a July interview.
Well, I tell him, listen, I've gotten more done in his name than he could ever get done on his own. He loves that line, by the way.
He worked on healthcare intensely for years, and his legacy is up for debate.
We're looking forward to coming down here on many different occasions, perhaps on the next one on healthcare.
The question today is whether the dynamics on Capitol Hill will change. Democrats hope it might mean Republicans will come to their side.
Hopefully, at this moment of reflection, some people will reconsider the positions they've taken.
His death could have an impact upon bringing some senators over, a kind of memorial.
But Republicans don't seem likely to change their position.
I wasn't a big fan of his politics, and I didn't really admire him, so maybe I won't say very much,
Even friendly Republicans have been stressing a different legacy.
The first thing he would have done would have been call me and say, let's work this out. And we would have worked it out so that the best of both worlds would work.
Naturally, the Democrats disagree.
Ted Kennedy would not walk away from the principles in this bill in order to get someone's vote.
Mr. Kennedy's celebrated bipartisanship led different sides to draw very different lessons for the health care endgame.
He would force people to kind of search for common ground and maybe redefine what success could be.
The Democrats could pass this if they could find unity, and maybe now, in the spirit of Senator Kennedy, they'll find that unity that he always preached.
His funeral has been scheduled for Saturday, and the events around it will offer a respite from the contentious health care debate. But Congress will return to Washington in less than 2 weeks, and the question is whether negotiations then will be any different than they've been before.